Thank you. Welcome to all. We're delighted to have you. We've had a tremendous response um, to this, I think our seventh stakeholder retreat. We're honored to have you be with us under these unique circumstances and so grateful you're accommodating these arrangements. We're just so proud of what Get Healthy Utah is accomplishing and doing. Let's just quickly go through the meeting. The meeting is being recorded, and we need your consent to that. All participants have been muted, and we ask that you remain muted until we have time for comments and questions. The agenda is I will just give a brief introduction and introduce our special and keynote speaker, Lieutenant Governor Deidre Henderson. We'll then have Sarah Hodson, our Executive Director, give an overview of Get Healthy's work. We'll divide then into breakout rooms for a One Utah Roadmap discussion of how we can integrate with Governor and Lieutenant Governor's One Utah Roadmap. And Janae Duncan will wrap it up, a member of our board, the Division Director at the Utah Department of Health. And at the end, we'll show a Healthy Utah Community video presentation by Nick Jarvis of the Utah League of Cities and Towns. This is an award that we created in conjunction with the League and has been awarded now to almost 20 cities. Most recently 13 at the League's conference in St. George last week. So we're delighted for that. Let me now introduce our keynote speaker. We're honored and delighted to have with us Lieutenant Governor Deidre M. Henderson. Lieutenant Governor Henderson grew up in Taylorsville, studied political science at Brigham Young University. After settling in Spanish Fork, she ran a small business with her husband, Gabe. She launched her political career as campaign and political manager for former Congressman Jason Chaffetz. The unique campaign and the methodology of that campaign, very inexpensive, and the subsequent victory rocketed her to fame as then Jason Chaffetz beat a longtime incumbent. And subsequently in 2012, Lieutenant Governor Henderson then successfully ran for the Utah State Senate. She was one of only 2 Republican women in the Senate and gained a reputation as a strong conservative, champion for governmental transparency, and a vocal advocate for women and families. She served as chair of the Powerful Rules Committee and other key assignments, and was recognized by numerous civic groups, including as Legislator of the Year for the Fraternal Order of Peace, and received Libertas Institute's Defender of Liberty Award. She rose to statewide prominence when Spencer Cox named her as his running mate for the historic 2020 gubernatorial election. And she and Cox emerged victorious after one of the most intense elections in Utah's history. Her organizational and messaging abilities, along with Governor Cox's confidence in her, has brought her an unrivaled level of public recognition for a lieutenant governor. She's interestingly a survivor of COVID, having suffered several surgeries and other continuing difficult side effects. And she is one who especially now values her health. She and her husband Gabe have been married 27 years. They're the proud parents of 5 children, 4 grown and 1 teenager, and they've resided in Spanish Fork for the last 22 years. Lieutenant Governor Henderson, thank you so much for joining us. We're honored to have you, and we'll turn it over to you.
Well, thank you so much, Greg. You're awesome, and I have big shoes to fill here. You're my predecessor here in this role as Lieutenant Governor and a state senator. So anyway, I've always looked up to and admired you. So thank you for the work that you do on behalf of the state. I am really happy to be here today. Yes, I am a survivor of COVID. I'm doing much better. It's something I wouldn't wish on anybody, and it's something that I know that we're all focused on and concerned about, and has really taken up the bulk of my time so far in my role as Lieutenant Governor. But it's one of the most important things that we can be doing right now is focusing on this. So I'm happy to be able to give a brief report this morning on our administration's One Utah Roadmap. I'm really excited that this is the focus of this gathering today. I'm really excited to hear about that. And in particularly, I want to talk to you about our efforts surrounding health security in our One Utah Roadmap. And when Spencer and I were running for election last year, we recognized that this was going to be the first time in 16 years that we had a true gubernatorial transition. And we wanted to make sure that we didn't waste any opportunities there. We were committed to making the most of that. So by the time the race was called for us on November 3rd, we had a team of volunteers in place to help us with our transition and really focus on two primary areas. And one was policy, and then the other was on state agencies. So our team really looked closely at every single state agency, did a thorough review. They dove into campaign promises that Spencer and I had made and really sought the best ideas from the brightest minds in the state to determine how our administration could make the best impact on the state. The result of that transition team and the incredible work that they did, it was over 100 volunteers, that can be found in our One Utah Roadmap, which really, it outlines 6 key policy areas that the governor and I are focusing on in our administration. And those are economic advancement, education, investment, and innovation, rural matters, health security, equality and opportunity, and streamlining and modernizing state government. Now, the health security section of the One Utah Roadmap focuses really on 4 key areas. The first, and so far, the most important one to get right, first out of the chute here is combating COVID-19. And so this really has been our #1 priority during the first 100+ days of our administration, combating COVID-19, and really doing that by getting shots in arms. We knew when we took office in January that this was the most important thing we had to do. It was more important than getting the budget done. It was more important than the legislative session that was coming up. It was more important than everything. And it was off to a bumpy start. Turns out that Christmas time, the week before Christmas, is not the best time to roll out a nationwide mass vaccine plan. So we came in January, at the beginning of January, understanding that there were some hiccups and some problems that needed to be smoothed out and maybe some strategies that needed to change. And so the first thing that Governor Cox did when we took office was to change strategies. We decided to rely on our local health departments to administer vaccines and move away from prioritizing special groups of people. We'd already prioritized the healthcare workers and the first responders, and teachers had been promised that they would be moved up to the front of the line. But we'd been inundated daily with people calling us saying, hey, we think that our group of people should be prioritized at the front of the line for vaccines. But the governor and I really wanted to make sure that we were saving the most lives. And we knew that to do that, we needed to focus on the people who were at the highest risk of severe illness or death with COVID-19. So we focused on age first and comorbidities second. And we did that. And right out of the gate, the governor asked me to go and visit all 13 local health departments throughout the state to identify barriers that existed to vaccine administration and remove them. He said, do whatever you need to do to make sure that the local health departments have the resources that they need to get shots in arms. We get our doses weekly, and we wanted to make sure that every single week, 100% of those doses were administered in arms. Nothing was being left on the shelf and nothing was being wasted. And so that's what I did. I went around, I spent a few weeks going around the state, visiting local health departments and really this is my first time really fully understanding what it is that our local health departments do and how really good they are at doing it. And I was able to help. If they needed personnel, I was able to send out National Guard troops, was able to help with technology needs, with financial needs, with other guidance that was needed. And we really started to see great progress. But of course, there were a lot of bumps along the way, and demand was far outpaced supply in those early months. But it didn't take us very long to realize that as good as our progress was, there were some people that were being left behind. And we know that health disparities have existed forever, but the pandemic really has highlighted them in ways that are very measurable and visible to people, especially people who maybe had not noticed them before. For example, we saw early on last year that the Hispanic community was being disproportionately hard hit by COVID-19. And when it came to vaccine distribution, when we started looking, we noticed that our ethnic communities were really being left behind. So we started early on focusing on vaccine equity and finding ways to ensure that our vaccination rates actually reflected our population. It became evident very quickly that just because a vaccine is available to a person and a person is eligible, that doesn't mean that it's accessible to them. Availability and accessibility are two very different things. A big mass vaccination clinic may be great for a lot of people, and it may work for almost everybody, but it might not serve the needs of some. And we care about the some. So it was very important to us to make sure that everyone who wanted a shot was able to get one. So we began identifying and removing those barriers to access for vaccines. And those, language barriers or geography barriers, income barriers, transportation barriers, health barriers, cultural or religious differences that might have created some barriers. And our local health departments really were the key, partnering with community organizations and others to make sure that we were getting into these neighborhoods and communities and even into the homes of individuals who otherwise wouldn't have any access to the vaccine. And we've made really, really good progress, but we're still falling short. And we recognize that. We still have a lot of work to do. Even with all of our efforts, as of today, the percentage of white Utahns who have received a vaccine is far higher than the percentage of vaccines among all other races or ethnic groups that we measure. In fact, it's more than double that of American Indian, Alaska Native, or African Americans or Pacific Islanders here in Utah. So ensuring this vaccine equity has taken a very deliberate, coordinated effort from our public health workers, from local health departments, community health centers, the Utah National Guard, private sector partners, and many, many others. So far, we've administered more than 2.2 million shots. Over 30% of all Utahns are now fully vaccinated, and over 55% of those who are 16 years old or older have received at least one shot. And this is really thanks to this massive coordinated community effort, tireless work on behalf of thousands of people. And because of that, our case counts, our hospitalizations, our deaths are down, and Utah really is in a good place. I know for probably all of you, this is not new, but for a lot of policymakers, especially here in Utah, including me, this pandemic has really opened our eyes to see disparities that have always been there, but that we were previously blind to. And now we can take these difficulties that we've endured over this past year or so and use those difficulties as opportunities, which Governor Cox and I fully intend to do as we move forward from vaccines to focusing on other health-related aspects of our One Utah roadmap. Another area that we're focusing on is access to care. And we realize that coverage and care are two very different things. They need to be treated differently, but Utahns need both of them. We're focused on expanding telehealth, especially as it is related to mental and behavioral health and substance abuse. We need to increase the availability of rural providers to give care in local settings. Another area of focus is on value-based care and transparency. We believe that healthcare consumers should be empowered with transparency as to what their healthcare costs are going to be, with quality data. We want Utahns to understand what goes into healthcare prices and healthcare. And we're making action plans based on racial and ethnic health inequalities. So the last thing that we're focusing on in our health security pillar of our One Utah roadmap is the social determinants of health. And we need to really focus on the drivers of improved health. What drives improved health? We're working on a statewide health equity plan to evaluate systemic changes that are needed in order to address these health disparities and invest in infrastructure for priority services that impact these social determinants of health. Now, we can't accomplish any of this without your help. It takes a lot of people to make sure that these challenges are addressed. In Governor Cox's first State of the State address, he shared our vision for collaboration as we seek unity in what we call One Utah. And I just want to read a little quote from him. He said, "Government was never designed to solve all of our problems. The founders of our state and nation understood this. It's not government that makes our country special. It's volunteer organizations and churches and philanthropists and neighbors taking care of each other and solving problems so government doesn't have to. In short, if we want smaller government, we need bigger people." Now, there's a role, of course, for government to play, and there's a role for everyone to play in ensuring that every single Utahn has a chance to have the health and the access to care that they need in order to reach their full potentials in life. So I'm very grateful for the many organizations who are thinking critically and coming together to solve these problems, to talk about long-lasting community-wide infrastructure and systemic changes that we need in order to address these health disparities, and the many organizations who volunteer time and resources in order to tackle these important issues and help change the culture surrounding health in our state. So thank you for what you do, and I'm excited to work with you moving forward in the future. Thank you.
Thank you, Deidre. We're delighted that you are where you are. Thank you for that illuminating address and showing us the inequities. And thanks for your incredible work. This is a job that you didn't sign up for, but certainly inherited. And I've been so impressed with the governor and lieutenant governor, how you've been Johnny One Note on vaccinations. You've identified the populations who need it, and you're going after it with hammer and tongs. So congratulations and thank you very, very much. Okay, let's move now to the rest of the program. I wanted just to highlight, given our mission, an article I read in the Wall Street Journal. Many of you may have seen it. And it just is another reminder of what we do and why it's so important. On May 3rd, so just a couple of days ago, there's an article by Andrea Peterson, "Teen Girls' Poor Diets Are Worrying Doctors." It says that 20% of American girls are anemic, and that 80% of adolescent girls consume less than the proper amount of calcium per day. Most girls, indeed most Americans, consume way too much sodium, which is a contributing factor to rising rates of cardiovascular disease and obesity. Interestingly, listen to this statistic: 98.8%, in other words, virtually all American girls 14 to 18, and the same 98.5% of boys that age, eat less than the recommended amount of vegetables. That's a non-surprise to parents, but still a huge cause for concern. Adolescent boys aren't getting enough nutrients either. they don't consume enough phosphorus, magnesium, and choline. And while they aren't even aware of these important elements, they gain bone mass between 11 and 14 years of age. And so it's just so critical that they eat correctly during this time. It's a worrisome thing. And so the mission of Get Healthy Utah is to address exactly problems like this, to make our public aware. We're not here about diets and bikinis. We're here about helping Utahns live productive lives through proper eating and an active lifestyle. So thank you for joining us today. And with that note, let me turn it over to Sarah, our Executive Director.
Thank you, Greg. I'm going to quickly share my screen. Okay, can you see that okay?
Yes. Excellent.
All right. Well, first, thanks to Lieutenant Governor Henderson for taking the time to meet with us today and share her thoughts. I'm excited for her leadership moving forward, and she did a great introduction to what we're going to talk more in depth about during the breakout sessions today. So I appreciate that as well. And I wanted to just also acknowledge the rest of the Get Healthy Utah board members you can see here, and you'll get to meet many of them throughout the meeting today. We also have a new advisory council that we started in 2020, and we appreciate their direction and leadership. Many of them are joining us today as well, so welcome to them. When I first read the One Utah Roadmap, I was struck by the vision, which is really highly aligned with the mission of Get Healthy Utah. We both are trying to create a state where residents are happy, safe, healthy, and successful. And this is highlighted in these images at the bottom of the screen. These are from our newly designated Healthy Utah community cities. And so you can see that throughout Utah, lots of work is being done to create places where residents are safe, healthy, and successful. Take special note of that bottom right picture, which is from North Logan, a biker gang of older women, which I think is just a great picture. Get Healthy Utah was started in 2015, and our mission is to create a culture of health. And we do that by focusing on physical activity and healthy eating specifically. And one of the things we did very early on was the Utah Health Values Study. So in 2017, we worked with Envision Utah and Heart and Mind Strategies to do a survey to get a sense of Utahns' perspectives on health. And these are some of the top line findings from that. Many of you have learned more about the value study, and many of you I know have incorporated it into your work. But one of the findings from that was that Utahns were in denial, and this was illustrated in a number of different questions on the survey. When we asked about rates of obesity, when we asked about rates of diabetes, they were in denial about those numbers. But one of the interesting ones that's represented visually here is we asked participants in the survey if they eat healthy, and the majority, around 60%, said, yes, I eat healthy. But when we asked them, do your neighbors, do fellow Utahns eat healthy? The majority said, no, they do not, which highlights that sometimes it's easier for us to recognize the negative health behaviors in others and not recognize them as well in ourselves. We also found that there's a lack of time, energy, and convenience, which are barriers to people participating in healthy behaviors, whether it's working long hours, spending too much time on screens, or the easy accessibility of fast food. Participants in the survey identified schools, communities, and workplaces as places that can make impactful change. And this was in strategies like requiring physical activity during the school day, making safe walking and biking in communities, offering fresh fruits and vegetables in the workplace, all strategies that participants thought would be beneficial. And then one of the most important parts of the values study is that it tells us about the why, about the motivation for people, why they do the things that they do. And what we learned in the health values study was that while people are motivated by things like wanting to feel better, wanting to reduce the risk of chronic disease, wanting to sleep better, they're more motivated by these emotional levels. They want to be able to be more productive and get more done. They want to be able to have a high quality of life. They want to be around for the people that they love, and they want to enjoy their life to the fullest. And so these are the messages that are beneficial when we're trying to get people to change behavior. There's a lot more in the Utah Health Value Study, too much to go into today. And if you're interested, please reach out for more information about that. And I know many of you have utilized these results. But I wanted to just take a few minutes to talk about the things that Get Healthy Utah has been doing since our last stakeholder retreat. And then to talk just a little bit more about strategies that we're working on. You know, one of the important parts of our mission is to engage with stakeholders like we're doing here today. And so I hope that when you hear about the different strategies and programs that we're working on, that it might spark some ideas for you on things that we could maybe be working on together and we could build better partnerships. So in schools, our effort has been focused around improving physical activity and healthy eating by making policy, system, and environmental level changes. So in early 2020, we worked with partners on best practice recess guidelines that the State Board of Education adopted. And these best practice guidelines indicate the importance of recess as a time for physical activity during the school day, and also prohibit withholding recess as a form of punishment. We are currently working with the Beaver Valley Hospital, USU Extension, and Mike's Food Town in Beaver to provide fruits and vegetables to school-aged children, along with a $5 fruit and vegetable voucher once a month. The bottom right picture, we can see us distributing some oranges in December. And then Get Healthy Utah is the lead for the United Way Promise Partnership Regional Council Health Team, very long title. We currently are focusing on supporting healthy foods in school pantries in the Ogden, Granite, and Canyon School District. This is with funding from the Utah Cancer Action Network. And we've been able to provide both fresh fruits and vegetables for children and their families, as well as other healthy snacks to try to address food insecurity. You can see the two photos on the top representing that. In schools, there's still work to be done. So we're proud of the things that we've done, but there's still work to be done to get schools to implement the recess guidelines that we worked on, to increase access to healthy foods in school pantries. There's still a big gap there. We're also interested in learning more about universal school meals, which would give all students access to free meals and improve food insecurity in schools. Over the past couple of years, Get Healthy Utah has also focused on improving access to the National Diabetes Prevention Program in worksites specifically. So either as a covered benefit or as a part of the worksite wellness program. As rates of diabetes continue to increase, employers are interested in finding ways to reduce the healthcare costs associated with it. And so the National Diabetes Prevention Program is a good way to do that. Employee wellness programs are ways to improve employee retention, satisfaction, and help with employee overall well-being. And the National Diabetes Prevention Program is a CDC recognized evidence-based program that's supported locally by a wide range of organizations. You can see many of them listed here. And so we've been working over the past couple of years with these organizations to try and make it easier for people with prediabetes who are at risk for diabetes, for type 2 diabetes, to have access to this important lifestyle change program. This past legislative session, we worked with Representative Suzanne Harrison on House Bill 194, which would have been Medicaid coverage for the National Diabetes Prevention Program. Unfortunately, the bill did not pass, but we were really excited with the momentum that it had, and we will continue to work on that effort to have Medicaid coverage of that important program. And we'll also continue to work on employer coverage and payer coverage so that throughout the state, people with prediabetes can have access to this program. So you may have heard the expression, your zip code is more important than your genetic code when we're talking about health outcomes. This is an image from the Kim Gardner Policy Institute. And you can see here that life expectancy by Utah's small area varies significantly when you look at the South Salt Lake area and the Foothill area, which are really just a few miles apart. The life expectancy difference is nearly 10 years. And we know that resources within a community and the built environment of the community are both extremely important for our health outcomes. Social determinants of health and upstream factors are increasingly understood to be a crucial factor in improving health outcomes for all Utahns. One of the best ways to improve physical activity at the community level is to improve the built environment and improve opportunities for active transportation, which means safe walking and biking. And in Utah, we're really lucky because there's a lot of support and momentum around active transportation. In fact, in the last legislative session, $35 million was allocated for active transportation projects. And there was also a reduction in the required local match for communities from 40% to 20%, which means more communities will be able to participate. This is an unprecedented appropriation of state funding in active transportation, and it's a really exciting time. A few other examples: UTA has continued their effort to support first and last mile projects, which are the beginning and ending of trips by transit modes. This is most often done by active transportation. If you've been in Utah County recently, and quite frankly, a lot of other areas of the state, you've seen a lot of these projects, I think, from the Lehigh Rail Trail pedestrian bridge to the UVU Frontrunner Station pedestrian bridge, which is illustrated on the bottom left. The bottom right is a map showing some changes coming to the Provo Frontrunner Station, including a pedestrian bridge there as well. Get Healthy Utah has represented the perspective of health on the UVision project by UDOT, and we've also partnered a lot with the Move Utah program. We've served on work groups of WFRC's Wasatch Choice 2050, which has an emphasis on livable and healthy communities. And starting this year with funding from Get Healthy Utah and Move Utah, the BRFSS, which is the state health department's health survey, we'll have a question on it asking about specifically access to transportation and the impact of a lack of transportation. So we're really excited to start seeing data come in from that question and be able to use that to inform future strategies. So even though there's a lot of great work happening here, there's still more work to be done. More to be done on making a better connection between active transportation and health outcomes, and then using that data to inform priorities in future projects. And there's more to be done to make sure there's equitable access to active transportation. This year, we have been extremely excited with the momentum of the Healthy Utah Community Designation Program, and Greg mentioned it a little bit at the beginning. This is in partnership with the Utah League of Cities and Towns, and we announced this project in September of 2020 with 4 pilot cities, and then just 2 weeks ago awarded an additional 11 cities and towns as a Healthy Utah community. And later in the program today, Nick Jarvis from the League is going to talk a little bit more about it. I was at the League's conference when we announced the awards a couple of weeks ago, and I moderated a panel of city leaders who had received the award, and they talked about the different strategies that they had done and why they felt like it was important to their community. They talked about things like how they found some budget funding and things like that. But one of the things that struck me was that even though the strategies that they implemented varied pretty significantly across those different communities in order to meet the needs of their residents, they all talked about how important it was to work with partners, to work with local coalitions, and to try to reduce silos. And so I think that that is really promising moving forward, and that each of us have the opportunity to reach out to the elected officials in the cities and towns where we live and work and encourage them to participate in this designation program. Through all of these efforts, Get Healthy Utah is working to keep a focus on health equity, which means that all people have the opportunity to attain their full health potential. In 2019, Get Healthy Utah adopted a statement on equity, and in 2020, our board and staff participated in a diversity and equity training. We've committed to considering health equity in all of our practices and programs, and to continue increasing knowledge and understanding for staff and board members. And one of the breakouts today is going to dive more into health equity, which will be really interesting as well. So today, as you know, is our 7th annual stakeholder retreat. In previous years, we have had the opportunity to bring our partners and stakeholders together, which is, all of you, and be in a room together to build relationships, to discuss health-related issues, have healthy snacks. I mean, those are great events, and we miss being able to do that. We know that solving complex problems like reducing obesity, like improving health behavior, physical activity, and healthy eating, these are things that require multiple sectors coming together in order to have shared goals and shared outcomes. No one agency or organization can adequately address these types of issues, and so it's through the collective work that we're going to see the best change. And to me, the stakeholder retreat really highlights that collective work. It's the opportunity to be together, to share those ideas and resources, and talk about moving better together and partnering better together in the future. So we're really glad to have you have joined us today, and we look forward to being together in person again soon. So the next part of our agenda, we're going to have breakout rooms. You have 4 breakout rooms to choose from. And that might be difficult because they are all really interesting topics. They're all drawn from the One Utah Roadmap. Lieutenant Governor kind of hit on multiple of these. In the chat, Locke is putting in a description of them, so you can kind of see a quick description and then make your decision on what you're